Hi, I'm Pamela, one of the nurses at the Evewell. Today I'll be showing you how to use Meriofert medication and how to prepare the injection. Now, before you start preparing the medication, make sure that you have the correct dose. Meriofert comes in different doses of 75 and 150. Now, if your dose is, for example, 300 units, you can mix 2 150 powders into one fluid to make 300 units. Before you start preparing the medication, make sure that you have clean, dry hands and that you have a clean, flat surface to work on. Also, make sure that the medication is still valid. So, what you will need is the medication, and what you will find inside the box is a vial that has liquid inside, and then you have a vial that has powder inside. Now, this powder is the actual medication. We will be mixing these two together to make the medication. You will also need a syringe of 2 milliliters and 2 different types of needles, a long needle and a short needle. These will be provided separately to the medication box, so please ensure that you have everything you need before you start preparing the medication. Meriofert is stored in a cool, dry place out of direct sunlight, and it can be used until the expiry date. When you start preparing the medication, you will first of all remove all the packaging from the syringes and the needles. Then we're going to start by opening our vials. So first of all, I'm going to open the vial that has powder inside. The easiest way to do this is to put your nail under the cap, and then you're just going to flick it off. And make sure that you put it back into the flat surface. Then we're going to open the vial that has liquid inside. The part that has a red dot, as you might see, this is the part that is weakest in the cap of the vial. If you don't have a snapper, please take some tissue, put it in between your fingers and the glass, and then you're going to place your thumb this way on top of the red dot. I'm going to be using a snapper today, so I'm going to put it on the top of the vial. I'm going to push it down, and I'm still going to replace my thumb on the red dot or on top of the red dot. Then I'm going to hold firmly into the vial, and then I'm going to snap it open. As you can see, sometimes the glass is a bit sharp, so try to make sure that you're not going to hurt yourself by putting your finger there. Place the vial calmly onto the flat surface, and it's very wobbly once it's been opened, so just make sure that it's not going to fall down. The cap goes directly into the sharp spin, but do keep the snapper because you can use this multiple times. We're going to use the long needle to mix the medication, and you will take the cap off from the needle after you've firmly attached it into the syringe. Make sure you're not going to hurt yourself, so put the needle away from the body. There we go. Then I'm going to put the needle inside the vial with liquid, and then I'm going to pull all the fluid into the syringe. So there's no need to think about the dose of the fluid. You will take it all back into the syringe. We're going to put all the fluid into the vial that has powder. So have a firm grip on the powder vial, put the needle inside and push all the fluid in. And now, as you can see, the powder and the fluid has started to mix straight away. It needs to turn into a see-through liquid like water, and that's when we know that it's ready to be used. It might take 10 seconds to 30 seconds, but just give it some time and make sure that the fluid is see-through and clear. If it does not turn clear in about 5-10 minutes, then you should not use the medication. Now, this one has turned into a see-through liquid, so we know that it's ready to be used. There's some pressure inside the vial, so at times the fluid will try to come back into the syringe before it's mixed. So therefore, I've kept my thumb on the plunger. When I release the plunger, as you can see, the fluid will start coming back into the syringe. Make sure that you also put the needle into the deepest corner of the vial. This way you will ensure that you don't get much of air and you mostly get just fluid into the syringe. Sometimes it might be that you don't get all the fluid straight into the syringe. So what you can do then, you push all the liquid back into the syringe, and then you place your needle into the deepest corner, and then you release the plunger, or you pull all the liquid back into the syringe. Perfect. And now we're done with mixing the medication. The next thing is to take the needle out of the vial And we're going to change the needle now. And it's easy to remember because it's very long. I'm going to take the long needle out and I'm going to put this directly into the sharp spin. Then I'm going to attach the sharp needle into the syringe. Make sure that it's firmly attached, push it in. As you can see, there's some extra air on top of the fluid. We're going to get rid of this air. It's not dangerous, but it might be a bit uncomfortable if you leave it there when you inject the medication. What we're going to do is push the plunger in calmly. Make sure that you're firmly holding the syringe. And as you can see, the fluid is coming up and the air is coming out. And once you see a tiny drop of fluid that comes out of the needle, that's when you know that it's ready to be used. And the next step is to inject. So I'm going to take the cap off, and then you will inject into the lower tummy under the belly button area where you might have some fatty tissue. That is the perfect spot. I'm going to pin the skin between two fingers, and then I'm going to put the needle inside in a 90-degree angle. And then I'm going to push all the liquid inside. Once the fluid is inside, I'm going to count to 5. 1, 2, 3, 4, 5. Then I can release the pin on the skin and I will take the needle out. After that, you're done. So then you have to discard the needles and the syringes correctly and you will replace them into your sharp spin.